Hello, my name is Nova Galson under Animal Science Department, second year. Today I'm here to present on the topic Actinobacillosis, which is also called as wooden tongue. I'm not able to present on the window capture views, so I'm going to directly present with uh, slideshare view. So I'm going to present on the topic Actinobacillosis, which is also called as wooden tongue. So for my presentation, actinobacillosis, here is introduction. Actinobacillosis is an infectious disease of domestic animals characterized by inflammation of tongue and soft tissues around neck, head, oral cavity, pharyngeal lymph nodes, esophageal groove, and nasal cavity. This is a disease caused by bacteria. This disease is rarely reported in the country, which means in Bhutan we don't have any cases as of today reported to the Department of Livestock or wherever. So most of these cases in remote areas go underreported. That's why it is not very common cases found in Bhutan. So synonym for this disease called actinobacillosis, we have wooden tongue, or it is also called as timber tongue. Epidemiology. Under epidemiology, this disease in cattle is worldwide, which means this disease is a pandemic disease. Distribution and can be usually of sporadic occurrence, which means this disease it occurs after a certain interval of time. So these are the animals susceptible to this disease. So animals are cattle, buffalo, sheep, and goats. They are susceptible to this actinobacillosis. So etiology. Wooden tongue is caused by Actinobacillus linearis is of the bacteria gram-negative and non-motile. Here non-motile it means these are the bacteria which cannot propel themselves or move themselves, so they are found at certain places uh, where they are firstly found. So this disease it is transmitted through infected discharges and contaminated pasture. So it's also transmitted through ingestion of contaminated food and water, and also from wounds and abrasions. So this wooden tongue disease, the organism causes a local infection in soft tissue, causing acute inflammatory reactions. Firstly, this the pathogenesis caused by uh, that bacteria. There is necrosis and separation of the tissue with discharge of pus. Here, necrosis it means localized death of cells or tissues, and separation it means decaying in tissue producing pus, which means this bacteria it causes necrosis and separation, which ultimately leads to formation of pus. Infection is spread to regional lymph nodes. So regional lymph nodes where this uh, if a, if this bacteria causes infection at particular region and around that lymph nodes, it will be spread after some duration. In if tongue is affected, then there is interference with prehension and mastication. It's definite that after getting infection in the tongue, they cannot or hold grasses or chew whatever. This they will have problem in prehension and mastication. Mainly, tongue is affected with prominent clinical signs. This bacteria mainly affect tongue, so it's also called as. That's the reason why it's also called as wooden tongue, because after getting infected by this bacteria, tongue of the cattle becomes very hard. So clinical findings: there will be profuse salivation, swollen tongue, hard at the base, and teeth apparently normal. Painful response on touch. So ulcer or nodules present in the tongue, enlarged submandibular lymph nodes. So here we have some of the clinical findings. We will be able to find if those cattle or animal is infected with this bacillus. As we can see here, we are able to find nodules, small nodules, and also to the dorsal part and at the base of the tongue, we are able to find kind of soiling out here. Those are the clinical findings we will be able to find after getting infected with Actinobacillus bacteria. So these are the post-mortem findings. Granulomatous lesions containing pus in mouth. After necrosis or suppuration, there will be formation of pus in the mouth. Abscess may be found in local lymph nodes. Hardening of the tongue and heart of the cattle, it becomes hard. These are some of the post-mortem findings. Diagnosis: this disease can be diagnosed through history and clinical signs, and also laboratory diagnosis can be done. Pus, smear, blood, and serum, these are the samples we can collect from those infected animals. And procedure: histopathological findings. These are some of the test or procedure we can proceed to find out what actually is the cause for the disease. So if it is wooden tongue, we can be able to find, we will be able to diagnose it through histopathological findings, which means we can have study on tissues or cells, so we'll be able to confirm that it is the wooden tongue disease. And also serotest can be carried out, and culture of the suspected material on blood agar. So after the animals are dead with this kind of disease, certain material can be collected from those carcass, and culture of those material can be done on blood agar to confirm the disease causing bacteria. These are the differential diagnoses. The disease may be confused with actinomycosis. It involves hard tissue, which means actinomycosis we also call as lockjaw, whereby animals, their jaw becomes locked. And TB, especially with atypical form, differentiates on basis of tuberculin test. Here, Uh, Unusual kind of TB. It also gives clinical signs uh, like in which the animals are affected with uh, Actinobacillus. So these two different mm, diseases can be differentiated through tuberculin test. Abscess of throat region contains single cavity and discharge thin pus and readily heal after drainage. So if there's formation of abscess, it can be drained out and it can be healed. So treatment for this disease, actually there's no vaccine as we know. Surgical drainage of the abscess and dressing of the wound with iodine. That is also called as aseptic treatment. It can The affected part can be flushed with iodine, and administration of potassium iodide orally for 6 to 10 gram once a day for about 10 days. And most importantly, streptomycin is a drug of choice for wooden tongue. It is given at the rate of 5 gram per day for about 3 days. And other antibiotics like tilmicocin also are effective and can also be given, and also some other antibiotics like tetracycline can be also given. So supportive care with fluid therapy can be done. So prevention and control of this wooden tongue causing disease. No vaccines are available as mentioned earlier. There's no particular vaccine for this wooden tongue disease, so we can have proper management practices to prevent from the disease. Provision of uninfected feed and water. So uninfected feed and water should be given to the animals to prevent from the disease. So these are the references I've used to prepare my PPT slide. So these are the references. So thank you and stay safe. Thank you.